It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Why did my dog's eyes change color? While some changes in a dog's eyes are considered normal, especially as they get older, most physical changes are signs of possible eye problems. One physical change that can occur in a dog's eye is a color change. Color changes can present differently depending on the cause. Let's first talk about the anatomy of a dog's eye. A dog's eye is quite similar to that of humans anatomically, with only a few differences. For one thing, dogs' eyes have a third eyelid for additional protection. Their eyes also have more rods in the retina that help process visual stimuli and help them see much better than we do, especially in the dark. The eye of a dog and that of a human are practically identical. It has a transparent outer protective barrier called the cornea and a white fleshy part called the sclera. Inside, the eyes are divided into two chambers, the anterior and the posterior. The two chambers are separated by the iris, pupil, and lens. The iris is the colored part of the eye and is responsible for dilating or contracting the pupil. The pupil is the small opening of the eye that allows light to enter from the outside. Incoming light is focused by the lens and received by the retinal rods at the back of the eye for interpretation. There are situations in which eye color change is considered a normal process, but most cases are due to specific eye problems. All of these parts can be affected by different eye conditions that can compromise visual function. Damage to any of these components of the eye can cause color changes, either on the surface of the eye or in internal structures. Common eye conditions that cause color changes in dogs. 1. Heterochromia. Heterochromia is described as having two different colored eyes. The color difference is seen in the dog's iris, the pigmented part of the dog's eyes. Heterochromia is a condition caused by a lack of pigmentation in one of the dog's irises. This results in one of their eyes being bluish or white. It is often hereditary and is passed on to the dog's offspring. Breeds such as the Siberian Husky, Australian Shepherd, Australian Cattle Dog, Border Collie, Dachshund, Chihuahua, Shih Tzu, Great Dane, and Dalmatian are predisposed to developing this condition. 2. Nuclear sclerosis. Nuclear sclerosis, also known as lenticular sclerosis, is described as the change in the color of the dog's lenses. This is considered a normal process and occurs as dogs grow. The lenses are made primarily of gel proteins, which become harder and change color as the dog grows. Nuclear sclerosis produces a blurry, gray or bluish appearance that can be easily confused with cataracts. Unlike cataracts, nuclear sclerosis is not a medical problem and does not affect a dog's vision. However, it affects the dog's ability to focus light and images. 3. Falls. Cataracts are characterized by increased opacity of the lens of the dog's eyes. This occurs when the protein component of the lens clumps together and forms a cloud-like substance, blocking light from entering the eyes. Unlike nuclear sclerosis, cataracts in dogs cause vision problems that can lead to total blindness if not treated properly. Most cataracts in dogs develop as a complication of an underlying condition, such as diabetes mellitus. Changes lens color from clear to almost white in severe cases. Other possible causes of cataracts in dogs are eye injuries in old age. 4. Glaucoma. The aqueous humor found in the anterior chamber of the eye is constantly produced and drained, maintaining a certain level of pressure inside the eye. Glaucoma develops when the drainage of aqueous humor is blocked, causing a buildup of fluid in the anterior chamber that causes an increase in pressure inside the eye, called intraocular pressure. This produces symptoms that include pain, eye twitching, lethargy, and decreased appetite. Due to the accumulation of aqueous humor, the anterior chamber becomes cloudy and bluish in appearance. If not treated in time, it can damage the nerve in the eye and cause blindness. 5. Scleritis and uveitis. Inflammation of the outside of the eye, called scleritis, or of the internal structures, called uveitis, causes color changes. In scleritis, the white part of the eye becomes bloodshot and the blood vessels become inflamed, causing the eyes to appear red. This usually occurs in response to corneal injury or irritation to the surface of the eye. Uveitis occurs when there is inflammation or significant injury to the eye, either from an infection or a deep corneal ulceration. Inflammatory cells migrate to the anterior chamber of the eye, resulting in a bluish, hazy appearance. This is usually accompanied by scleritis, conjunctivitis and excessive tear production depending on the severity of the trauma. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.